Hello everyone, welcome to the tutorial for week 1 of phase 3 of our 1901 Postal Pensioners shared learning project. Okay, let me just start sharing my screen. Okay, so this week's lecture, I suppose you could call it, or talk, is really quite basic. It's sort of just going to go over some of the broad strokes of the project, sort of introduce how to sort of conceptualize the history of medicine. But really most of what you'll be doing this week is watching the video tutorials. So in this first part, I'm going to kind of look a bit more about how I as a historian approach the history of medicine, and how we as a project really approach the history of medicine as well. So when I was thinking about this, how to introduce people to, this branch of history, I think really the important thing to do is to realize that we are, in most instances, dealing with diseases and conditions that have a biological basis, right? I think it's very important that we as historians realize this, that, diseases have material histories, so having TB is not like having cholera, having cancer is not like having diabetes, and so on. So you have to start, a good place to start is with the biological. So thinking about, okay, so what causes this disease or condition? What are its symptoms? Because that's very important, right? If we think about pulmonary TB, one of the signs of advanced pulmonary TB is coughing up blood, and that obviously, has significance for thinking about how people might have reacted to having that disease or reacted to people who had that disease. And then also thinking about how common was it, as well. But then you can then kind of move on to the social aspects of disease. So think about who is at risk of catching this disease or developing this condition and why. That's the big thing. And that's something we're really interested in the project, were postal workers particularly at risk for developing certain conditions. Then think about how is it diagnosed, because that definitely has a social element to it, when we're thinking about the power relationship between doctors and their patients. How is it treated? A common example of this, women were treated often very differently in the medical sphere, often still are, and that has a social element to it. That has broader significance for thinking about, how Victorians and Edwardians kind of conceptualize women and their bodies. And then lastly, how did it affect the lives of those who had it? This was a time before the National Health Service, where recourse to treatment was often quite limited. So, we have to kind of think about, how did it affect the material realities of the man on the street? And I'm doing air quotes around the man on the street here, because that in itself is a bit of a problematic term, who was the man on the street in Victorian Britain, but you kind of get the gist of what I'm saying. So one way to think about the histories of health and medicine then is thinking about the relationship between the biological and social dimensions of disease and ill health, which are never really as clear-cut as you may think. So I've got some examples here that, you can kind of use to think about the relationship between the biological and the social. So like, how did Victorian housing conditions, which is, a social factor, facilitate the spread of infectious diseases like TB? So how did these cramped, often very cramped living conditions affect the spread of M. tuberculosis, the microbe responsible for TB? Then kind of going over to a example which has a sort of less clear-cut biological cause. In some cases, doctors are still debating a lot about the biological causes of mental health conditions and stuff like that. So this is a bit more of a hazy area. But thinking about, how did popular ideas about womanhood influence the treatment of mental illness amongst women? How how is sexual behavior seen as a sign of ill health, whereas today we would not necessarily see it as that. We would just see it as a sign of, a woman being in control of her body and exercising her agency, in a way that the Victorians might not have seen it that way. And then kind of tying it back into the history of work, thinking about, okay, what was the relationship between new types of factory plant and hearing loss in 19th century Lancashire? So thinking about how the social conditions at work, how the technical changes that affected many workplaces in this period, had a direct impact on people's health and well-being. And really, the history of medicine is also about the lived experience of ill health. And this is where the tricky thing comes in for the historian of medicine, is how do we get at the patient's perspective when first-person accounts of what it's like to be sick or unwell in this period are often really sparse. So often our source material can be quite limited. And during this project, we're actually going to be quite limited in what we can look at, not just because we're not able to get to the archives right now, but also that is sort of just the way of things in the history of medicine a lot of the time. Much of the primary material that survived was written by the medical practitioners rather than the patients themselves. There are exceptions, of course, but often we're having to kind of go to these texts to try and understand what life was like for the patient. But there are alternatives to first-person biographical accounts, of course, that can help us understand the social history of a certain disease or condition. Visual media is often really good. I think advertisements are one of the most interesting sources in the history of medicine. When you guys are doing research into newspapers, you always keep an eye out on the adverts, and you'll see so many of them are patent medicine adverts. So medicines that are designed for common ailments. A really interesting one, actually, is there's so many adverts for things for dental pain and dental work. And they're often these like tonics, which are sort of like an all-in-one. So, they say it will cure everything, that you might have. Or tonics for nerves, or, just anything. There's such a rich world of like kind of business history there. But then again, even though that we're not getting the patient's perspective there, the very existence of these advertisements tells us something about the kind of common conditions or complaints that bothered people at this time. So, it's about reading against the text a bit, if you can. And this is, I have an example of here of a stomach, liver, and blood tonic, that was advertised around the turn of the century. We've also got fiction. So tuberculosis, was a very common sort of literary trope or device. I'm thinking particularly, if those of you who've read Jane Eyre, the death of Jane Eyre's friend, I think Grace, her name was, I need to check, in the school, and she's sort of seen as this figure. And like I said, try not to discount the usefulness of medical texts for trying to get at the patient's perspective, because really they contain a lot of things that help us try and imagine what having a certain disease or condition might have been like. So thinking about, how was it diagnosed? What were the treatment options like? Was the prognosis good? You kind of have to use your imagination here. As much as, historical actors are very dissimilar from us, it's still worth the time putting yourself in their shoes and thinking about like the kind of discomfort they may have felt at certain diagnostic devices, particularly, and the treatment options, which were often quite a strain on the body, for lack of a better word. So in this shared learning project, as I've said quite a few times now, we're limited in that, we don't have access to your pensioners' sickness rates or their absence reports and so on. So really, the only thing we have at our disposal is your pensioners' cause of death. So really, you're investigating your pensioners' end of life health. And, the clue we have for that is, the cause of death on on their death record. And this is a death record for an Irish postal pensioner who retired, I think, in 1871, who died in 1892 at the age of 73, of debility and constipation and exhaustion, you know. But luckily, there are actually a wealth of medical texts really freely available online. And this week is really about introducing you all to the Medical Heritage Library, which is hosted at the Internet Archive, and the Wellcome Digital Collections. So, yep. So for this bit, please go ahead and watch the Medical Heritage Library tutorial after this is finished. Just a sort of overview. It's an absolutely huge collection. You know, over 320. Pardon me. Over 320,000 digitized items as of February 2021. It's always growing. And these are from a number of repositories. So you have the Wellcome Library, the Royal College of Physicians of London, the University of Glasgow Library, lots of American repositories, but really so many. It'd be endless slides showing you the amount of people who've contributed to this. And it includes not just books, but includes also like journals, leaflets and films. So it's not just, you know, the kind of bog standard medical textbook you might be expecting. So, yep, that's the tutorial. Okay, so this I felt is important to address. What do you do when you don't understand a term? And I really need to emphasize this to you guys. We are not all expecting you to suddenly become trained doctors. A lot of the time I come across a term, I have no idea what it means. And that's absolutely fine. It's getting the broad strokes. That's what is important, you know. So you don't need to know the minutiae of, you know, exactly how you did, you know, a certain diagnostic test, like how you had to do an acid fast reaction to the diphtheria germ, you know, like we're not expecting that. We're not particularly interested in it either. I mean, if you're interested in it, please go ahead and look. You know, there's fun details behind technicalities sometimes, but we're not expecting you to know the ins and outs of how these different tests or technologies worked. And so if the book or text you're reading seems too dense or difficult, feel free to leave it and go look for another more accessible text. And on the syllabus as well, I have a link to medical dictionaries, both contemporary and historical, for you to go look at. And again, if you don't understand a term, that is absolutely fine. Absolutely. Okay, so Medical Heritage Library already has a lot of the Wellcome stuff on it, but there are some stuff from the Wellcome that you can only access on the Wellcome's website, and it has a particular collection strength relating to documents about the history of mental health and mental health care. So, yep, if after this you want to watch the tutorial. And okay, so now I'm going to go on to questions for next week. So these are some ideas I'd like you guys to consider thinking about using the resources I discussed in the separate tutorials. So using the cause of death on your pensioner or pensioner's death certificate if you want to investigate more than one, and by exploring the resources we've covered this week, I want you to consider the following. What were the symptoms of this disease or condition? And how might have affected your pensioner's day-to-day life if they'd lived with it a long time? And I'm not expecting immediate answers. I'm not expecting you guys to definitely know how it would have affected their life, especially because, yeah, as the weeks go on, like, we'll be exploring more and more what your pensioner's life might have been like. I guess what I want you to do this week is think more about, on a real basic level, you know, like the kind of pain they might have experienced, you know, the kind of, you know, the bodily experience of being unwell, you know, how that might have affected them. So yeah, and just a few things to remember. These are just ideas to get you started. Again, as I've always said about this phase of the SLP, if there are research rabbit holes you want to go down them. I'm really encouraging that. I really want you guys to feel free to explore. And it's absolutely okay if you feel unsure about something or feel that you aren't able to answer the question. The most important thing for you this week is to start feeling comfortable looking at stuff on the Medical Heritage Library. Okay, that's the most important thing. So if you come to the discussion group and I'm more than happy for you to say, like, I got a bit lost or I'm not actually sure. That is absolutely fine. Okay, so with that, on that note, I'm going to go now rest my voice, which I was more croaky than I realised it was, and say goodbye to all of you. And I look forward to discussing this with you in our discussion group. Okay, thank you.